So a big question that I get is, why is it important for a speech therapist to work in collaboration with a behavior analyst and an occupational therapist? For me, working with this population as long as I have, there's no question in my mind that I need an occupational therapist and I need a behavior analyst. In our clinic, for example, when I have a child, and I'm experienced with children with autism, but when I have a child who's having behaviors that I can't seem to get a handle on, I go next door and I talk to my behavior analyst. And oftentimes they'll come and shadow and they'll say, oh, okay, in this particular situation, it would be better to do this. And the same with occupational therapy. I have a child that I just evaluated to use an AAC device, right? To use an iPad as his words. He doesn't have any verbal speech. I had my occupational therapist come in, and while I was doing the evaluation about his language skills, she was evaluating whether or not he'd be able to hold an iPad, whether or not he'd be able to touch all of the buttons that I need him to. And, you know, I mean, that's just one example of how OTs and a behavior analyst work together with speech-language pathologists. There's a thousand things that we do every day that we work together that really helps us to treat the whole child and not just the speech child.